How are you?
Good. Welcome to the dental office. Are you ready to go back and get started?
Let's do it.
Okay. Come on back. How's your morning been so far?
So good.
So good. All right. So we're going to start today by going over your medical history. How's your diabetes been? Have you been maintaining your levels well?
Yeah, I think so.
What was your reading this morning?
I don't know what it was this morning, but last night it was 120. So.
Okay.
And I think I'm fine. I feel fine.
Did you have breakfast this morning?
Did not have breakfast. No.
And no lunch either?
Did not have lunch.
Okay.
But I did have a mimosa this morning.
Oh, my girl. Okay. Alrighty. Pause. One might notice that the patient here is A, diabetic, B, has not had anything to eat, and C, might be feeling a little tipsy, if you know what I mean. Alright, we're just going to start with probing today, okay? I'm just going to call out some numbers. Go ahead and open. 5, 4.
Ow.
You okay?
Jeez.
Sorry, your gums are a little inflamed. It might hurt a little bit.
Ow. Ow. Jeez. Oh.
Emma,
Oh.
you feeling okay?
Just got a headache.
Such a baby. Well, what can I do for you?
I don't know.
It's gonna make you happy.
Oh. I really don't feel good.
Fine, I'll give you a Snickers. Nobody can, whatever.
Mallory didn't handle the situation correctly. But I mean, everybody really does like a Snickers. Let's watch it again.
All right, Emma, we're gonna start with probing today. Okay, I'm just gonna go around and check the tissues of your mouth. 3, 4, 3.
Oh, jeez.
Feeling okay?
It's just too hard.
Okay, I'll try and lighten up a little. Sorry, your tissues are a little inflamed. What's going on?
Oh, my head hurts. And it's really hot in
Are
here.
you getting a little dizzy?
Yeah, I don't feel so good.
Maybe your blood sugar's low. Let me get you a Snickers, okay?
Yeah, that might help.
Okay, go ahead and have a bite of this. I'm gonna grab the blood pressure cuff so that we can monitor your vitals. Go ahead and lay back for me, Emma. We want to keep your airway open, okay?
This should take about 15 minutes for Emma to feel better. But as you can see, Mallory did the right thing this time.
How you feeling, Emma?
A lot better.
A lot better?
Oh, yeah.
Do you think we can continue with treatment today?
I think so.
Okay, we're just gonna keep some orange juice handy. If you start feeling sick again, you just let me know and we'll give you some more, okay?
Okay.
So we'll just pick up where we left off.
Awesome.
Okay, Emma, we got done with your medical history. We're just gonna do treatment today. So I'll go ahead and get my stuff on and we'll get going. We're gonna start with probing for today.
Alrighty.
Sorry, it takes a second to get all my gear going.
10 minutes later.
Ah.
Girl, are you okay? This isn't like you.
Ah. Okay. So painful.
Are you
Go
okay?
a little lighter, please.
Yes, let's try that again. You okay? You're looking a little sweaty.
Yeah, I'm good. Just feeling a little hot.
Okay, let's give you a second.
Okay.
Do you need to sit up?
One might notice that she is experiencing symptoms of hypoglycemia, dizziness, headache, irritability, several more.
Where is it? Useful. Not right now.
handling the situation properly? No. Reboot.
Emma, are you okay?
Code blue! Code blue! Code blue!
Chelsea, call 911. I'm administering oxygen. I will now give the patient an IV containing 20 milliliters of 50% dextrose. I'm going to monitor the patient's vitals until EMS comes.
Pause. Mallory did a much better job this time. Her kit was packed with the essential items, and the patient is unconscious, and she's following the procedures. Let's take it back a little bit. At the beginning of the appointment, Mallory brought in her patient and went over her medical history. As she went over it, she noticed that a few risk factors for hypoglycemia, one of them being diabetes. Our patient was diabetic. She had also missed a few meals, as well as had drank some alcohol. These are all some risk factors of a hypoglycemic episode in the process. Now, Mallory, in response to these hypoglycemic risk factors, took the proper care, but also did a few things wrong. Let's take a look at those. Mallory, what did you do right?
I remained calm, cool, and collected throughout the procedure and administered the correct protocol for both a conscious and unconscious patient.
For a conscious patient, Mallory did the right thing by getting a Snickers or some type of item that has enough sugar to help bring our patient's glucose levels back up. For an unconscious patient, she also did the right thing by administering oxygen, contacting the EMS, administering 20 milligrams of 50% IV dextrose or glucagon 1 milligram, and also continued to monitor vital signs. Even though Mallory did some things right, she also did some things wrong, which are:
she panicked, she did not have the correct items in her medical kit, she did not take me seriously, and quite frankly, she treated me like a real piece of
Thank you, Emma. Hypoglycemic episodes can happen in diabetic patients as well as non-diabetic patients. It can happen if somebody just is not treating their body like they should and the glucose levels drop. Hopefully this helps.
Here we go. All right, we're going to start with probing today, okay? So I'm just going to feel around a little in here. 4.
hey. Jeez.
You okay?
It's hard. Just lighten up a little, please.
Sorry, your gums are a little inflamed. I see some gingivitis. Ooh, 7.
Ow! It's hurting.
Feeling okay?
Yeah.
What's going on, Emma?
My head is hurting.
You're such a baby sometimes.
That would be so funny.
10 minutes later.
Useful, not right now.
We're gonna have to
Action.
Emma, are you okay? Chelsea, call 911. Administering oxygen. Administering an IV with 20 milliliters of 50% dextrose. I need to monitor her vital signs. Same hard as the IV.